Gatekeepers. Just the mention of the word creates a feeling of uncertainty for medical reps. This is the person they have to get through if they want to get to the decision maker. And now it's harder than ever. What should you do? That's what I'm going to be talking about in this episode of the Medical Sales Channel. Hello, my friends. My name is Mace Harf. I want to welcome you to the Medical Sales Channel, which is dedicated to helping you sell more in the medical device, biotechnology, pharmaceutical, and life science world. Now, I've been doing workshops and speaking at national sales meetings for over 15 years. And I got to tell you, when I'm in front of a group of medical salespeople and I ask them to identify their biggest challenge, do you know what it is? Well, you probably can guess based on the title of this video. I kind of gave you a hint. Yes, it is getting past the gatekeeper. Now, just that term, gatekeeper, is kind of funny. I think of someone who looks like a troll, or maybe someone who's about 7 feet tall, 285 pounds, ripped with muscle, who makes it just impossible for anyone to venture past. And you probably feel that way when you approach some medical offices or practices or a clinic or hospital, and the person might have all the impact of the person I just described, but it might be a small person who weighs maybe no more than 102 pounds. But yet, medical reps struggle with this. And in this era, when we're dealing with airborne viruses that kind of freak everybody out, a lot of practices don't want to see salespeople, especially those who are uninvited, which would never be you, of course, because you're special. Just kidding. Hopefully you are special, but you're not going to be special everywhere. So how do you deal with the challenges of gatekeepers, especially in an age where it's harder than ever before because they don't want salespeople to come in? Well, there's a couple of different ways. Number one, understand why they don't want you to come in. There's lots of reasons. They're busy. They're seeing patients. But a big reason is they don't want extra bodies coming in that could be exhaling coronavirus. They just don't want that risk in their practice. Doctors and other healthcare professionals, they want to protect themselves and their staffs and their patients. Makes sense, right? So there are options to this, such as virtual sales calls. And you've noticed I'm talking about virtual sales calls a lot. Why? Because virtual sales calls are an option that can get you in. Now, virtual isn't the only way to go. Sometimes you want to combine virtual with live sales calls. This is called a blended selling approach, and it works brilliantly if you know what you're doing. But contacting a gatekeeper and just offering a virtual sales call, is that going to get you in the door? Hell no. Sure, if you're calling virtually, you might not be bringing with you the risk of a virus because, as far as I know, we can't transmit viruses virtually via video. Because if that were the case right now, I suggest you move 6 feet back from the screen and put on a mask. You don't have to do that because we're virtual. If we were face-to-face, I'd tell you to put one on because that's what we're supposed to be doing these days. But that's not the case. So it's not just the virus. There's one other thing. You have to be able to at least allude to your reason for contacting the decision maker is a reason that is going to be relevant and of value. There's that V word again, value to them. Now, this might seem like table stakes because it is. Yes, if you're a salesperson, you're supposed to sell value and you're supposed to communicate value. But the reason that medical salespeople are not getting in front of customers today is because they either don't know how to communicate value or they're not communicating relevant value. In other words, relevant value is not what's valuable to you. No. It's not what's valuable to you. You have a product, you think your product is valuable, and it is valuable to you because when you sell that product, you get paid. So your product is valuable to you. You have to make your product valuable to your accounts, to the stakeholders in your accounts. That's what needs to happen. And who do you communicate this to when you first contact the account? Well, if you don't have a direct line to the stakeholder, then you communicate it to the gatekeeper. Yeah, I know you hate that word. But again, if you have a relevant message that the gatekeeper can present to the decision maker, you're going to get in. And is it okay to bypass the gatekeeper? Sure. If you have a way to connect with the decision maker directly, then by all means do it. But it has to be in a relevant way, which is suggesting relevant value, which means it's going to be really about them and not so much about you or your product. Now, hopefully you know how to do this. If you don't know how to do it, better get help. Or even worse, don't assume that you know how to do it. If you know how to do it, you are getting access and you are making sales right now, even during this tough time. If you're not gaining access and making sales like you were before, then there is an issue. Fix it. One of the ways to fix it is by attending a free webinar presentation that I am presenting. It is called How to Use Virtual Sales Calls to Access and Engage Doctors, Dentists, and other healthcare professionals to be able to sell more. You can get more information and register for this free presentation by going to medicalsalestraining.com/webinar. Again, medicalsalestraining.com/webinar. You will be glad you did, because this just doesn't talk about virtual selling. It talks about how to specifically use virtual selling to be able to gain access, be relevant, and get past those nasty gatekeepers. Yeah, they're really not nasty. Most gatekeepers are great people. Give them a chance and give the webinar a chance. Check it out. By the way, if you are watching on YouTube and you found this information helpful, please give us a thumbs up and subscribe. I'll have more of these coming forward. In the meantime, you need to go out there and sell something. So why don't you do that? I will talk to you again soon. Until then, this is Mace Hara from the Medical Sales Channel, wishing you good selling and stay safe. Bye for now.